Hello, good afternoon, everyone. Thank you very much for joining me. I'm Hayley Hamilton, and I think that we're going to have to try to figure this out together sometimes because there are certain functions that I cannot see on my screen right now. So hopefully all is well and everyone is seeing the screen properly. So I'm just going to try to do a little bit of housekeeping here. So we are going to be speaking today about cannabis use among youth in Ontario, specifically. Okay, and so housekeeping first of all, and my mind is going to be, I have to pay attention to multiple things at once. So again, I'm very sorry for because this will slow things down a little bit. So housekeeping. I'm going to present first, and then again, in the interest of time, I think it would be best if we leave the questions until the end. There is a Q&A function that I think you can access if you kind of flick your browser around the main screen. You should see an option for a Q&A. I don't think your chat function will work. So any questions you have, you can post through the Q&A, and then I will get to it at the end. So voice and chat functions, as I indicated, I think are disabled. And so I will try to monitor things closer to the end with respect to the Q&A. So I think that's all the housekeeping I have at the moment. So I hope all is well, and I am going to proceed. So again, thank you for joining me. I wish we could have done this in person because I would be much more comfortable with this, and I could actually be present in the moment with you there. But we'll try to soldier on in our current situation. Okay, so let's see if we can advance a slide. Here we go. So just in the interest of disclosure, this is just a slide basically indicating government and non-government funding that I am on projects in which I'm a participant. Okay, so we'll move on to what are we going to be talking about today? Basically, today we're going to be talking about cannabis use within the Ontario Student Drug Use and Health Survey. Near the end, I will also bring in some findings from COVID pandemic specific study, not that are OSDUHS related, but general, just to give you a sense of what might be happening right now, given the situation that we're in. It's hard to believe that we're over a year into this. So that's basically the plan. Estimates of cannabis use, some attitudes and perceptions of risk among youth. And then we're going to be talking a bit about the pandemic. So specifically, the estimates, cannabis use estimates I'll provide is from the 2019 Ontario Student Drug Use and Health Survey. And again, that was our last survey. It's done every 2 years. And in the 2019 survey, it included around 14,000, a little over 14,000 students in grades 7 through 12 from 47 school boards, 992 classes in 263 schools. Now this survey, as I mentioned, is conducted every 2 years, and it covers a wide spectrum of issues facing adolescents and youth. Specifically, again, drug use, which we're one aspect of which we'll talk about today, mental health, just general well-being, such as gambling, social media use, screen time, school climate, things like that are also covered within our survey. But today we'll talk specifically about cannabis use, as that's the nature of the conference. So when we look at estimates for cannabis use in the past year specifically, we can see that among grade 7 to 12 students, around 22% reported that they used cannabis in the past year. And this proportion, and again, I'm trying to make an adjustment here, sorry. This proportion is similar for boys and girls. So no statistically significant differences between boys and girls with respect to prevalence of cannabis use. And this compares to around 19% in 2017. So not statistically significantly different from what it was in the last survey wave. When we look at cannabis use By grade, ethno-racial group, again, what are some of the characteristics of those who use cannabis? And here we can see that prevalence of cannabis use increases with grade. A percent of the students that reported using cannabis at least once in the past year increases from about 1% in grade 7 to around 40% among grade 12 students. So you can see, again, in the high school age range, how it increases with time. When we look at differences by ethno-racial group, racialized groups specifically, you can see that among Black students is around 17%. The highest percentages, though, in prevalence is among those who are considered mixed, white and racialized, mixed in that sense, 28%, and among those who reported being white or identified as being of a white background are 29%. Now, one of the important aspects of cannabis use and why it is that what we think about when we think of cannabis use is frequency of cannabis use. That's the main consideration when we think about risk for or among youth. So when we look at frequency of cannabis use, 22% in the past year. When we look at use in the past month, we see that around 14% reported using cannabis in the past month, which is the month prior to them completing the survey. This 14%, again, 86% indicated they didn't use. So this 14% are these groups are among these particular types of frequencies, 1 to 2 times per month, 1 to 2 times per week, 3 to 6 times per week, and the daily users. And those who use daily are of particular concern, again, because even higher frequency of use. So here we have daily use at 2%, and that daily use is higher among boys, or it's more prevalent among boys than it is among girls. Prevalence of daily use increases with grade and is highest in grade 12, similar to past year use, which we saw in the earlier slide. And daily use, prevalence of daily use was higher in 2017, in 2019 than it was in 2017. So that gives you a general sense of frequency of use and the percentage who uses cannabis daily among this particular age group. Another question that's of particular significance, especially now and over the last few years, is how are students using cannabis? So this question was asked specifically among grades 9 to 12 students, and we can see those around 1 in 5 reported using it via joint or pipe bong around that same time. Edibles was at 14%, which is higher than it was in 2017. 2017 was 11%. In 2019, it showed us 14%. E-cigarettes, 10%, and other things, blind 10%, and the others are much less prevalent within the student population. Another factor when thinking about risk from cannabis use is age at initiation. How young were these students when they started using, meaning how long have they been using cannabis? And here we can see, this is basically a trend graph that shows prevalence over time from 1999 through 2019. And you can see the blue is alcohol and the purple is cigarettes, green is cannabis. And you can see that the prevalence of cannabis, or age group, the age at which they begin using, is increased over time to now around 15 years of age. Same thing with alcohol, same thing with tobacco, cigarettes. So students are using at an older age, or starting to use at an older age than they did in the past, which is a good thing. Cannabis and alcohol use on the same occasion. This is a question because, again, when used especially in a social setting, there are concerns about the mixing of cannabis and alcohol. So this graph basically outlines the prevalence of cannabis and alcohol use on the same occasion. 14% indicated that they engaged in that use. At grades 9, it's 6%. Grade 12 is around 27% reported that they use cannabis and alcohol on the same occasion in the past year. When we look at, grade 7 through 8 was not reported because the estimates are too low. When we look at cannabis and tobacco use on the same occasion, which is on this lower graph here, we can see overall around 5% reported that they engaged in that behavior. And again, much higher among those in older grades, around close to 10% among those in grade 12. Again, the estimates for grade 7 to 8 were suppressed due to low numbers. Here, percentage of drivers in grades 10 to 12 who reported drinking alcohol and driving or engaging in cannabis use and driving in the past year. And this shows the trends over the last 20 years from 1999 through 2019. And so here we see that there's been a decline in both. But interestingly, in the blue, you can see that those who report cannabis use and driving, or the prevalence of cannabis use and driving, remains higher than the prevalence of drinking and driving. And you can see again right here, there's this behavior. Both behaviors actually are more prevalent among boys than they are among girls. It's more prevalent in higher grades. It's grade 12. And you can see the approximate number of drivers that are represented by these percentages right here. 6.8% drove within an hour of using cannabis, and 4% drove within 1 hour of consuming 2 or more drinks of alcohol. A particular question that is often asked, given that even now with the legalization of recreational cannabis, it's still not legal for youth to be engaged in cannabis use. So how are they getting cannabis? So this is a question that we've asked usual source of cannabis right here. And interestingly, you can see that friend, that there's a common theme here, and that 35% reported that they were given cannabis by a friend, that they shared it around a group of friends, that they bought it from a friend, or other means at around 1 in 4 reported around getting it through other means. Trends in perceived great risk of harm from using cannabis. And again, we asked youth, what do you perceive a great risk of harm from using cannabis, trying it, or regular use? Red is regular use. You can see that there's a decline in perceptions of harm over time, over the last 20 years among this population with respect to trying, and more with respect to regular use. And with respect to, again, how easy it is to get, 45% reported that cannabis was easy or very easy for them to get access to. Now, given legalization, we included a question in our 2019 survey that asked about their friends' use of cannabis since legalization of recreational cannabis. And we have 36% reporting that their friends don't use cannabis. But here we can see that 14% reported that their friends use cannabis more often now than they did prior to legalization, with a very small proportion reporting that they use less, and over 1 in 4 reporting that there was no change in use among their friends. And again, when thinking of cannabis and risks to youth, we're thinking about problematic use. And when we examine results from the severity of dependence scale for cannabis use, we can see that around 3% of students in high school reported symptoms of cannabis dependence. And here you can see what those symptoms are. There were no differences, statistically significant differences between boys and girls. And again, 3% of students, high school students, when we look at the percentage among students who reported using cannabis in the past year, that percentage is 11% reported symptoms of cannabis dependence within the last year. So again, a little bit higher, about 1 in 10 among those who reported using cannabis. Now, we talked about cannabis and I present the findings with respect to cannabis use. But what are the social and health risks that we're concerned about? Why is there such concern about cannabis use? And before, in the lead up to legalization, in the years leading up to it, there was a lot of consultations and talk in the media and within academia about the harm to the brain. You know, that brains are not developed, the brain is not developed until around the age of 25, so there was a great deal of concern about what would happen with increased use among youth. In addition to harms to the brain, there are concerns around academic problems, again related to harm to the brain, cognitive difficulties that youth might experience, difficulties with completing their homework, performing more poorly or poorly generally, increase in school, and maybe a higher risk of dropping out. Relationship difficulties is a concern, of course. You know, difficulties with parental relationships, etc., are a problem when we think about social and health risks. We worry about whether to what extent there are conflicts in the home, conflicts at school, conflicts at work for youth who work. Physical health harms, again, concerns about lung and respiratory problems for those who smoke it in particular. Mental health problems, given the associations quite often between cannabis use and mental health. And we also worry about addiction among youth who engage in cannabis use, as there are special concerns, I should say, with respect to addiction among youth. Okay, so moving on. So cannabis use and the COVID-19 pandemic. Now, when we think about why are we concerned about cannabis use during the pandemic, well, I think that we all know that there have been a lot of difficulties just generally among the population. If we think just among ourselves and what we have been experiencing, it's a real issue that we're just one moment. I'm going to have to just, oh, sorry. I'm just trying to get a, sorry. Just a second. There's some noise interference here, so I'm trying to just stop that. So I'm just going to pause for a moment. If I can get the pause to end technical issues here. Okay, sorry about that. I had to get my headphones. Sorry. Why the concern about cannabis use during the pandemic? As I was saying, that there are real concerns among all of us about what's happening during the pandemic. There are especially concerns among youth population, especially grades 7 through 12 who are in schools right now, who are going through high school and junior high. As we know, there's been a lot of upheaval with respect to schooling. One moment they're in school, a few weeks later they're out of school. They have to adjust to online learning. There are real issues and concerns about mental health problems that might be experienced, that students might be currently experiencing at the moment. And so one of the risk factors, or one of the concerns with respect to all the stress and uncertainties that students are experiencing is that they might engage in greater substance use. They might be experiencing depression. They might be experiencing a lot of anxiety, et cetera, et cetera. So when we think about mental health, we also tend to think about substance use. And since we're speaking about cannabis use today, this is a particular concern for this population. So with respect to what research has been done, about a year ago, this study by Dumas et al. Was published shortly after the pandemic began. And basically what the author did, was to compare the percentage of adolescents who reported using cannabis pre-pandemic, which was about maybe 3 weeks before the pandemic, the shutdown in March, to after the pandemic, about 3 weeks after the shutdown. And we can see that there was a decline in the percentage of adolescents who reported using cannabis from about 17% to 14%. But the average number of days that they used cannabis, there was a slight uptick, going from around less than a day last week to about a little over a day here. So there was just a little bit of a uptick with respect to cannabis use. There's not much, so that's just one study that shows some increase over time. I keep pressing my computer keys when I should be using the mouse pad. our own study looking at an adult population, for example, again, just giving you two examples of what has occurred with respect to cannabis use. The percentage of those who use cannabis relative to now, when they were interviewed relative to before the pandemic. So that's the question we asked them during our survey. And we found that in the survey, these results actually reflect 3 waves of our survey. The first wave occurred in May, and the third wave was, I believe, occurred in June. So this is basically a pool sample, and you can see around 52% of overall adult population reported increased cannabis use, that their cannabis use increased during the pandemic than before the pandemic. And while there's about 48% indicated that there was no change or decrease. And this was specifically among those who reported using cannabis. So this is just among cannabis users, which is why it's 32%, which is not that much different from other results from last December in another poll that was published. But what is relevant here is that the risk factors were greater for those among those reporting cannabis use, or increased cannabis use among those who are 18 to 49 years of age, much more likely to report increased use than those who are older, those with less than college or university education, those who lived in Ontario. Again, this was a national study, and those who reported being somewhat worried about the impact of the pandemic on their personal finances. So here you can see that for those who are younger, again, we have additional waves of the survey, so we will examine again with the increased sample size whether this was particularly more prevalent among those, for example, 18 to 29 years of age. As our sample size increase, we'll be able to look more closely at the younger groups specifically. And I think about 20 minutes have passed, and I left some time for some questions. So maybe we can now. I'm going to have to try to figure out the question and answer. So if anyone has any questions or any points of discussion or anything that they would like to talk about, I didn't want to go the entire 30 minutes just me talking because it's very disorienting because I can't see anyone. So if anyone has any questions, please let me know through the Q&A function. Okay. Thank you. Well, and now I'm told it's 5 minutes that we have left. So if anyone has any questions through the Q&A function, please let me know. Okay. Or I can just keep talking among just generally about what I found interesting from our data, and it's something interesting to think about more generally is that, sorry, I lost my headphones again. In talking about the source of cannabis among youth, and it's something that I've been thinking about, we see quite often that many of them are getting cannabis from their friends. So it's really interesting to see, with more data coming in and more studies being published, to what extent that is a factor, because kids are not in school as much. And they're not interacting in person as much with their friends. So it's really interesting to think about for those who are using cannabis now, even at increased use, where are they getting their cannabis from? Will that have changed as a result of their experiences during this past academic year, or the current academic year is not over as yet? So that's something to think about. It would be interesting to have a conversation with those who are using cannabis, about how are they using it, where are they getting it from, and how are they using it? Are they still using in groups? Are they using in isolation in their room? So that to me is one of those interesting questions that I think it would be good to explore moving forward when we think about what's happening. And another question to think about is, we looked at pre-legalization and post-legalization, and that was such a factor in the lead up to legalization. So it's thinking about now, what are the implications of COVID on those kinds of analysis? I see a question here. Do you know if there are plans to investigate changes in use due to the pandemic? Now that it's been a year, as other stats are from early in the pandemic. Yes, there are plans to investigate changes in use due to the pandemic once we have data. So for example, the data presented here from the Ontario Student Drug Use and Health Survey from 2019, to what extent we will have data for this year from that survey, it's still uncertain. We're still trying to get data. So the extent to which it'll be directly comparable, we're not certain at the moment, but we most certainly hope to have data that we can compare, and we also hope that other surveys, whether here in Canada, or sometimes there are larger school surveys as well in the US, for example, can address that more directly. That would be great, because it's definitely an important question to answer. Any other questions? Any other points anyone would like to make? Okay. Okay. So if there are no additional questions, I think we can maybe leave a little early. I'm probably 2 minutes early since we got the 5-minute warning a while ago. I'm trying to, ooh, that's not good. Okay, we have the 1-minute warning. So I think we can wrap up now. So thank you for joining me. I hope that it was informative, and I hope to see you in person at the next conference. Thank you. Goodbye.